Today I would like to discuss new developments in keratoconus. So in our practice, we see quite a number of patients with keratoconus that were either referred here or that we diagnose when they come for laser vision correction screening. So traditionally, the advanced type of keratoconus were treated with corneal transplants, and that's in the 80s and 90s. We were performing penetrating keratoplasty, where we do a full thickness corneal transplant, and that has developed into lamellar surgery, where we only do a replacement of the diseased part of the cornea, and that has now evolved into where we create rings made out of corneal tissue. We call it CAIRS. It stands for corneal allogenic intrastromal ring segments. And that is what I would like to discuss, as well as some new developments with regards to cross-linking. Now, when we talk about ring segments, we have to mention the traditional PMMA, or the plastic rings, that's been around for a couple of years now, and very, very effective, and we had some great results with these rings. The only problem is that the cornea does not like a foreign object into and like within it. So with these corneal ring segments, we did see quite a number of complications. With the new corneal ring segments that are made from corneal tissue, those possible complications have decreased dramatically. The other advantage of the rings made from corneal tissue is that we can customize it. So with the plastic rings, we will send data through to the company, and they will help us to choose a ring, and there were all different shapes and sizes. It didn't make it easy because you had a set recipe for which rings to use, but it wasn't much customizable afterwards, and it was quite unpredictable. So with the allogenic intrastromal ring segments, or CAIRS rings, we can customize it. So we have a good idea of which size of ring to use, the thickness, and when we get our set effect, which is also not always predictable, one can adjust these rings after a few months and hone in and just fine-tune that result. So these rings are also reserved for patients with relatively advanced keratoconus, and we call it grade 3 keratoconus. So how would a patient know if they've got grade 3 keratoconus? So those are patients that cannot see well with their glasses, that have to use scleral lenses, and they still, with their scleral lenses, they see very well, but with their glasses, they still have shadows and difficulty driving at night. That will be a good indication of stage 3 keratoconus. So with the effect of these CAIRS rings is that we improve the patient's best corrected vision. So yes, the patient will have an improvement of his vision without glasses, but there will be, the main aim is to improve his vision with his glasses. And again, also, this is reserved for patients that are not happy with their scleral lenses, or that are struggling to use their scleral lenses, or are intolerant with their scleral lenses. Because again, no surgical intervention is going to give you the same quality of vision that you will get with your scleral contact lenses. So this is an exciting new development in keratoconus management. We are looking forward helping many patients and preventing them from needing corneal full thickness or partial thickness corneal transplants. having good outcomes with minimal complications, and there will be a couple of cases that where we have performed these procedures